look at where we are in our immune response, we start with that infection or an injury. We're going to stimulate the macrophages and dendritic cells. They're going to make reactive oxygen species, prostaglandins, leukotrienes. They're also going to make those pro-inflammatory cytokines. And this combination is going to give us inflammation. Inflammation tenets are pain, swelling, redness, and heat. Okay? Now, while we think biologically, physiologically, IL-1, IL-6, TNF-alpha, pain, swelling, redness, heat, it turns out there's sickness behaviors that are associated with each of these. Interleukin-1 is that malaise, depression, I don't want to get out of bed feeling when you get sick. It turns out that interleukin-1 stimulates that sort of depression, sleepiness mode. Interleukin-6 is completely different. You know, when you get sick and you're like, oh, I can't be sick right now. I have so much to do. The anxiety, that's IL-6. And TNF-alpha is aggression or hostility that comes when we get sick. Like, get out of my way. I just have to get home. I'm sick, right? So what's interesting is different people express different amounts of these pro-inflammatory cytokines and therefore tend to have a dominant behavior when they get sick. They're either the anxious person or they're the fully depressed person or they're just aggressive. And there's been research now on individuals with cardiovascular disease who are that type A driven personality, that they're actually expressing more TNF-alpha than those who don't have that driven personality. So our sickness behaviors give us some clues as to what the underlying cytokine pattern is. It's also important that this is bidirectional. So not only does IL-6 make you anxious, but if you have anxiety, your interleukin-6 goes up. Not only does TNF-alpha make you aggressive, but if you're getting into road rage, your TNF-alpha goes up. So it's important to recognize that this bidirectional relationship means that people who, for example, have depression will have dysregulated interleukin-1. Their IL-1 will be higher. All right, let's keep going. So these are symptoms then that are going to come with the inflammatory pathway. Not only are you going to get the pain, swelling, redness, and heat, you're also going to get the fatigue, the depression, the anxiety, and the aggression. And we see that in patients with chronic inflammation. Now I want to talk a little bit more about IL-6 because IL-6 has a lot of clinical relevance. It's involved in inflammation. It's involved in stress and anxiety, it's involved in infection, and it's involved in pain. And we know that chronic inflammation often goes with pain. So let's just talk a little bit longer about interleukin-6. We did a study with Beth Darnall, who is a pain researcher at Stanford, looking at interleukin-6 with people who catastrophize. What is catastrophizing? Catastrophizing is when you feel pain and you think you're going to die. My grandma had this. So she would go, oh, I have the pain. It must be the cancer. I should stop buying green bananas because I'm not going to be around to see them ripen. And we would all go, oh, Grandma, you're going to be fine. And it was never the cancer. But that's what happens with people who are catastrophizers. They stub their toe and they think their toe is going to fall off. We had this question about whether these people actually produce more interleukin-6 than people who are not catastrophizers. Is the interleukin-6 making them catastrophize? So we did a study where we recruited people who had pain and tended to catastrophize. We asked them to catastrophize about their pain for about 10 minutes, and then we asked them to stop. And we measured their interleukin-6 throughout and then after. And we discovered something very interesting. We discovered that men and women are different. I know, it's hard to believe, right? Men and women are different. But men and women are very different about how they catastrophize about pain. What we saw was that men would catastrophize for the 10 minutes, and then when we told them to stop, they stopped. And their interleukin-6 went back to normal. And women would catastrophize about the pain for 10 minutes, and when we told them to stop, they wouldn't stop. They would ruminate. In fact, their interleukin-6 went up for the next 6 hours. What does that tell us? Remember, interleukin-6 is involved in inflammation. And so what we're seeing with women is we're seeing higher levels of inflammation because their stress and anxiety about something actually continues much longer than it does in men.